Monkeypox case in Thailand confirmed in transit passenger at Suvarnabhumi Airport last week. First case detected in Thailand is a transit passenger who only spent 2 hours at Suvarnabhumi Airport and was asymptomatic. Nevertheless, the Ministry of Public Health remains vigilant and is putting in place plans for potential protocols if required. Thailand on Monday confirmed its first case of monkeypox. A top official revealed that the case was that of a transit passenger travelling from Europe to Australia last week who was in the kingdom for only 2 hours. The news follows an announcement on Sunday that 3 suspected cases of the virus were, in fact, instances of the herpes virus. The chief of the Epidemiology Division of the Department of Disease Control within the Ministry of Public Health, Dr. Chakarat Pittiyawanganan, has confirmed 1 case of monkeypox in a transit passenger in recent days travelling from Europe to Australia via Thailand who was reportedly asymptomatic. Dr. Chakarat Pittiyawanganan, the head of the Epidemiology Division at the Department of Disease Control on Monday confirmed that Thailand has detected a verified case of monkeypox in connection with an Australian business class passenger who transited through Suvarnabhumi Airport last week. This followed a false alarm in recent days when 3 suspected cases turned out to be cases of the herpes virus, which is a similar virus to both smallpox and monkeypox according to officials. Department of Disease Control boss confirms false alarm as 3 suspected cases turned out to be herpes. On Sunday, the Department of Disease Control chief, Dr. Opas Kankawinpong, confirmed that lab results had shown the cases to be herpes. Dr. Opas used the occasion to assure people that the monkeypox virus is quite unlike the airborne virus that drove the pandemic in Thailand for the last 2 years, as it is less easily transmitted and requires extremely close contact. However, initial information shows that monkeypox infection does not spread as easily as COVID-19. Transmission requires close interaction with asymptomatic individuals, Dr. Opas told reporters. Business class passenger in transit from Europe to Australia last week tested positive for monkeypox. On Monday, Dr. Chakarat did not identify the patient who tested positive for monkeypox at the airport except to say that he was flying from a European country and later continued his journey onwards to Australia. The passenger is believed to have also been asymptomatic for the disease, but a test conducted showed he was carrying the virus. It is understood that he was in Thailand for just 2 hours as a transit passenger at Suvarnabhumi Airport before flying onwards to his destination in Australia. As a result of this, 12 staff and passenger crew are in the process of being monitored for the disease, although the top medical official felt that it was quite fortunate that the airline passenger was traveling business class, as this allows for increased seating room and distances between passengers on the plane. Ministry plans possible quarantine, other protocols as it screens for cases, no need for action now. The patient who travelled to Australia for several days was found to be infected. It's good that the patient was sitting in business class, sitting far enough apart. The infection is not easy to transmit. Must be really close if not far away, because the germs do not float away by themselves. As in the transmission events in Europe, there must be close hugs and kisses, so this disease is not easily contagious. You have to come in direct contact with the patient during the period of illness, he explained to reporters. He announced that the ministry was putting in place treatment procedures and rules concerning quarantine, but there was no need, at this point, for any further action beyond monitoring the people who were in contact with the transit passenger for the next 2 to 3 weeks. Major risk to Thailand are incoming travellers. Dr. Chakarat said the ministry was monitoring the disease and deemed the major risk of it spreading in Thailand as coming from people entering the country from abroad. This was particularly so with high-risk countries which now include Spain, Portugal, the United Kingdom and Canada. The latest figures show 406 confirmed cases around the world, with more countries being added to the list including Ireland, Malta, Mexico, Ecuador and Pakistan. Currently, Spain, the epicenter of this latest virus, has the largest number of cases with 134, followed by the United Kingdom with 101, Portugal with 74 and Canada with 63. Germany now also has 22 cases.